I have spent 16 years cutting into the smallest, most fragile bodies on Earth. My world has always been one of preparation and precision. Each morning begins in the surgical planning room, stainless steel counters gleaming, monitors humming quietly, the smell of antiseptic clinging to my gloves long before I scrub in. I chart every case in a leather-bound operative log, its pages color-coded, red for vascular anomalies, green for gastrointestinal, blue for the rare congenital outliers that challenge textbook diagrams. Before every surgery, I take a silver fountain pen, a gift from my first attending, and sketch the relevant anatomy in calm, deliberate strokes. It is my way of ordering chaos before it's exposed to the cold lights of the operating room. The children's surgical wing sits deep in an older part of Boston Children's Hospital. The corridors here are longer, quieter, lined with polished linoleum that reflects the overhead LEDs like a still canal. Behind the sterile renovation, you can feel the bones of the building. Old brick, Victorian arches sealed behind drywall, faint echoes that shouldn't carry as far as they do. At night, when the elective cases have ended and the day teams have gone home, the place feels hollow in a way I've learned to appreciate. There is a purity to night surgery. Fewer voices, fewer opinions, only the hum of the HVAC and the precise choreography of a small, well-trained team. Fear, I've always said, is ignorance of cause. The unknown is not frightening once you understand it. That belief has been the bedrock of my career. Over the years, I've repaired hearts the size of walnuts, untangled intestinal malrotations knotted like sailor's rope, and excised teratomas, grotesque tumors that sometimes sprout hair or teeth. Even the so-called fetus in fetu cases, where a malformed twin is found inside its sibling, eventually yield to embryological explanation. Nothing, I've told myself, is truly inexplicable when approached with the discipline of anatomy and genetics. Tonight's assisting resident, Dr. Naomi Patel, is still young enough to tremble slightly behind her mask. She's sharp and ambitious, but carries the restless energy of someone desperate to prove herself. I see parts of my younger self in her. The way she peers at scans like puzzles to be solved, the way she measures her confidence against the room's silence. I did not know, as I organized my notes and diagrams tonight, that my faith in cause and effect would meet something it could not dissect. At that moment, under the hum of ceiling vents and the watchful cartoon murals on the dimmed walls, I believed my protocols were unassailable. I believed there was no case left that could truly surprise me. I would be proven wrong. I was proven wrong at 02:11, when my pager shook against the table like a trapped insect and flashed the single word that rearranges any night: stat. The emergency consult came from Pediatrics. A 6-year-old boy, abdominal distension, escalating pain, intermittent vomiting, normal labs except for a mild anemia that did not explain the severity of symptoms. The CT had been done by the on-call radiology resident. The attending had already been called in from home. I walked the old corridor toward imaging, Naomi matching my pace, the soles of our clogs whispering on linoleum. The hallway carried that after-hours soundtrack I've grown to trust. The sustained breath of the HVAC, distant monitor beeps, the punctuated clack of a vending machine coil dispensing something sugary to a tired nurse. Under the LEDs, the painted animal murals went flat and watchful. Context first, anomaly second. This is how you keep a team steady. If this is a mass, I told Naomi as we scrubbed sanitizer into our palms outside the reading room, it's most likely teratomatous. She nodded, eager. Teeth and hair. Sometimes, I said, a teratoma is a tumor that forms from early embryonic cells, the kind that can turn into many tissue types. Think of them as over-enthusiastic building blocks that kept building the wrong thing. I kept my tone even. And fetus in fetu is rarer, remnants of a malformed twin trapped in the body. The difference matters. One is tumor biology, the other is a developmental entanglement, I added, as I always do for trainees. Either way there are rules. Tumors grow as masses. Remnants have predictable attachment points. The radiology attending met us in the doorway, mouth a straight line behind his mask. Elise, you need to see this. We stood before the workstation. CT first, axial slices stepping through the boy's abdomen like a flip book. The usual landmarks appeared, and I narrated in simple terms for Naomi, and if I'm honest, for myself. Liver, spleen, loops of bowel, the curved shield of the pelvis. In surgery, naming is grounding. It tells the body you recognize it. Then the anomaly slid into frame. At first, I thought the workstation had cached an image from a skeletal survey. The shape was tiny, dense, and unmistakably human in outline. A skull with clear sutures, a spine, rib arcs, delicate as willow twigs. The pelvis like a narrow bowl. More unsettling was the articulation. The joints were distinct, as if engineered. Ball and socket shoulders, hinged elbows, radio-ulnar bones paired like a textbook diagram. Not ossified chaos. Design. This can't be fetus in fetu, Naomi said too quickly, seeking a familiar hook. The limbs in those cases are malformed, fused. Correct, I said. They're usually encased, tethered, incomplete. I pointed to the screen. This is articulated, joints like jewelry links, and there's no soft tissue envelope consistent with a twin remnant. I switched to MRI. The T2 sequence gave us fluid and fat as bright signal. No musculature, no organoid blobs, just cartilage caps whispering along joint lines, and threads of something finer than ligament holding darkness together. Wires, Naomi said. Too uniform for scar, the radiologist murmured. And no metallic artifact. Then what is holding it in place? Naomi asked. Gravity, I said, and immediately knew that wasn't true. The thing coiled in the deep abdomen like a question mark. It did not slump the way a passive structure should. It nestled. We walked to Pediatrics. The ward lights were overnight low. Parents' chairs formed small fortresses beside cribs. A respiratory therapist rolled past with a tank that ticked like a metronome. In the final room, the boy lay on his side, knees up, guarding his stomach. His name was Micah. His hair stuck to his forehead. Someone had given him a sticker of a blue whale. It clung to the bed rail at eye level. I introduced myself to his parents the way I always do, with outlines instead of assurances. I'm the pediatric surgeon on call. We've reviewed the imaging. There is an unusual structure in Micah's abdomen. It's not behaving like a tumor, and it does not look like what we call fetus in fetu. I kept my words plain. We need to remove it safely to relieve his pain and to understand what it is. His mother's face had that stunned, polite stillness of people who have stepped unexpectedly onto ice. Is it cancer? I don't see the features of a typical cancer, I said truthfully. But leaving it in risks obstruction, I added, a blockage or bleeding. Operating now gives us the best chance to help him. While I spoke, Micah watched my hands. Not my face, my hands. When I gestured, his gaze travelled with the tips of my fingers as if tethered by invisible thread. I stilled them. His eyes stilled. I lowered my hand toward the bed rail. His eyes dropped in parallel. Children are attentive by necessity. They read adults for cues, but this felt more exact, like tracking. Does your tummy hurt right now, Micah? I asked. He nodded without shifting his eyes from my hand. I flexed my fingers very slightly. His pupils narrowed as if focusing. Outside the door, Naomi exhaled a laugh too sharp to be humor. Sorry, it looks like a doll. In there. We don't label what we don't yet understand, I said. It was not a rebuke so much as a rule I enforce for myself. Names ossify. Misname a thing and you operate through the wrong map. We prepped for a dawn start. The OR scheduler freed Theatre 3. Anesthesia assembled a lean night team. In the locker room, I opened my logbook and drew what I'd seen. My pen traced a skull the size of a walnut, a thorax like the ribs of a music box. I added the thin connecting lines, hesitant where to place them, because the films did not agree with gravity. Naomi watched over my shoulder. You're drawing joints, she said softly. I am. I capped the pen. Because joints imply motion, I added. And then, because she is my trainee, and because saying the impossible out loud makes it shrink. And motion implies muscles or a force we can define. We wheeled Micah down the silent corridor. The building shifted around us with its old pipe's percussive knocks, a plumbing phenomenon called water hammer. I explained it to Naomi so she wouldn't jump, and also because I needed one system in this night to behave as expected. The cartoon murals along the route smiled the fixed smiles of painted animals. In the elevator, Micah's mother squeezed my forearm. "Bring him back," she said. I answered with the only promise I make. I will do everything precisely. In the anteroom, we performed the ritual of control. Checklists, consent reconfirmation, timeout board filled in block letters. I described to the nurse, for the record and for myself, what the initial plan would be. Midline incision, a straight opening along the center to give us full visibility. Gentle evisceration, bringing bowel out carefully so it's protected. And exploration. If it fixed to major vessels, we'd slow, call vascular. If it attached to bowel, we'd resect, remove the segment and reconnect. Speaking the steps is the way you remind your hands they belong to you. Anesthesia pushed propofol. I watched the numbers settle. Oxygen saturation a steady plateau at 99. Heart rate down from fear to sleep. We prepped the abdomen with chlorhexidine, the cold brown antiseptic drying to a tacky sheen. Drapes rose around a sterile island of skin. The surgical lamps floated into place, throwing daylight where there was none. Through the glass, the corridor lights were dim and distant. The cameras above the door blinked their indifferent red. Inside our circle of brightness, the air smelled of warmed latex and chlorhexidine, and the metallic hint that only steel has when it anticipates use. "Scalpel," I said. The instrument lay in my palm with its familiar, measured weight. Naomi stood opposite, hands poised, eyes fixed, not on my face, but on the line I had just imagined. The doors eased shut on their soft hydraulics. The theatre sealed itself with a sigh. Under the lights, the first cut waited, thin as a thought, between what I knew and what the films insisted on showing. The theatre was cold, the way only a night awe can be. Chilled air heavy with antiseptic. Fluorescent white lamps suspended like silent moons. Our team was small. One scrub nurse, one circulating nurse. A single anesthesiologist already monitoring Micah's vitals. The monitors purred in a steady rhythm. Heart rate 92. Oxygen saturation unwavering at 99%. Normal. Comforting. I like to narrate the setup. It slows my hands and keeps the room anchored. "We'll go midline," I said to Naomi as we finished scrubbing and held our arms out for sterile gowns. A straight incision gives us full access to abdominal organs, stomach, intestines, liver. If it's tethered to anything vascular, we'll have exposure to control bleeding. I said it calmly for her, but also for myself. Every time you speak the map, you reinforce the boundaries of the known. We draped Micah's small abdomen until only a pale rectangle of skin remained. The prep solution dried to an amber glaze. I checked my instruments, scalpel, Metzenbaum scissors, long DeBakey forceps, electrocautery. The familiar choreography. The robotic assist arms hovered to one side, gleaming with articulated precision. It struck me. Those arms were built to mimic us, to learn from human motion. The thought passed like a ripple. "Ready?" I asked. "Ready," Naomi said. Her voice was thin but steady. Scalpel. The first incision is a ritual. You don't slice. You press just enough to part skin and subcutaneous fat in a single deliberate line. The blade whispered through tissue. The scent came immediately. Cauterized blood has a sweet metallic tang, distinct from trauma. It's the smell of planned invasion. My glove squeaked faintly as I widened the opening with retractors. Layers fell away with methodical order. Fat, fascia, the pearlescent sheath that holds the abdomen together. Nothing unusual yet. I explained as I worked, for Naomi and for any invisible witness. We go through layers carefully. Each has a purpose. Skin protects. Fascia keeps muscles taut. Peritoneum is the inner lining that contains the organs. When we breached the peritoneum, the air changed. A faint, earthy smell of living gut and antiseptic mixing. Bowel loops glistened under saline, pale pink and quietly pulsing. Everything was as expected, until we reached deeper, where the mass should have been. It was not a mass. Nestled between loops of intestine was something the colour of old ivory, small but unmistakably organised. A rib cage no larger than my palm rose and fell, faintly, impossibly, as though drawing invisible breath. A spine curved in a perfect question mark. Tiny clavicles, scapulae, arm bones, a doll-sized pelvis. Every joint seemed purposeful. Tiny ball and socket articulations capped with faint cartilage. And it was wired together, not with metal, but with thin, glistening filaments that anchored bone to bone in patterns too regular to be random. I felt Naomi freeze opposite me. Is that bone? I said. My own voice sounded farther away than I intended. Fully articulated, no muscle, no vasculature. I added the obvious, because saying it might keep the ground beneath us firm. Bone cannot move without muscle or external force. It was breathtaking in the way an unanticipated predator is, not simply strange, but designed. I found myself whispering an analogy that came before I could stop it. It's like opening a music box and realizing the figurine is watching you back. Naomi's breath caught. Did it just... No, I said too quickly. Muscle relaxation. Post-mortem shift. But I had seen it too. A fractional tilt of its tiny skull when my scalpel traced air. We called for a portable fluoroscopy unit, live X-ray. The radiology tech wheeled it in, eyes widening despite professional discipline. We shot quick images. On the screen, the skeleton appeared clear and perfect. And in one frame to the next, the posture changed. Only subtly, an arm that had lain across its own ribcage now rested at its side. Vertebrae no longer curved exactly the same way. Artifact, Naomi whispered. Maybe, but artifact doesn't respect anatomy. And these changes were coherent, like a body adjusting position. I told myself to lock back into protocol. Stay in the map, I murmured. My own mantra. I reached with DeBakey's to gently elevate a rib. My movement was slow, deliberate, controlled. And then it moved. No twitch this time, no chance reflex. Its miniature arm shifted fractionally, in perfect mirror to mine. Naomi gasped. Elise, stay in protocol, I said sharply, though my pulse stuttered. I wanted the words to cage the fear rising from somewhere I usually keep sealed. We dissect, we identify, we control. But as I spoke, the impossible detail pressed harder. This was not reactive. It was observant. The way a student shadows a mentor. My hands felt suddenly heavier. I adjusted my grip to test. A subtle rotation of forceps. The tiny ulna and radius rotated in reply, delayed by less than a second, like a perfect echo. No one moved for several heartbeats. Only the monitor broke the silence with Micah's steady 90 BPM. Dr. Gardner, Naomi said softly, it's copying you. I forced my voice back to calm. No, it's responding to tension. Surgical field shifts can... But my rationalization sounded thin even to me. The skeleton lay coiled but attentive, its tiny chest plate rising and falling without lungs, without diaphragm, without any source of motion I could name. Inside my mask, the first bead of sweat cooled against my lip. I anchored the retractor more firmly, reasserting control with mechanical precision. We continue, I said. Stay in protocol. It was as much to myself as to her. Because if I admitted what my eyes were telling me, that something inside this child was not just alive but learning me, then I would be operating without a map for the first time in 16 years. And that, more than any grotesque anomaly, is the surgeon's true terror. Naomi's eyes met mine above her mask, wide, uncertain, searching for the belief I had just begun to lose. I turned back to the tiny ribcage and, with movements that felt suddenly exposed, prepared to go deeper. Somewhere beyond the reach of light, the pipes groaned again, the hospital's familiar water hammer, normally benign. Tonight it sounded like a slow, deliberate knock. And in the sterile silence, with my gloved hands poised over something that should not move, I felt, for the first time in my career, the edge of fear press through the armor of protocol. The next layer awaited. For most of my career, the next step after exposure has been a quiet, almost meditative act. Define the margins, isolate the anomaly, remove it intact if possible. I have done this hundreds of times, but as I stood over Micah's open abdomen, staring at a structure that seemed to have anticipated my last move, every familiar pattern felt suddenly provisional. Like standing on ice you trusted a second ago and hearing it groan. I motioned to Naomi for a fresh pair of long Metzenbaums. My own forceps trembled almost imperceptibly. I willed the shake into stillness. "We'll start freeing the superior attachments," I said, the calm tone a mask I've worn for years. To her credit, Naomi tried to steady herself too, but I could hear the difference in her breathing under the mask. The plan was simple. Identify where this lattice connected, divide any fibrous bands, mobilize it whole, a surgeon's version of carefully untangling a marionette. Yet as soon as my tip touched one of the glistening threads tethering the ribcage to bowel, the entire structure shifted just before my scissors closed. Like a chess opponent moving preemptively, the rib rotated away from the cut. Not recoil, anticipation. Naomi jerked back a fraction. It moved. Elise! It knew. "Muscle spasm," I said, automatic, though we both knew there was no muscle here. Saying the word was a lifeline to order. The anesthesiologist's voice broke the moment. Dr. Gardner?" Heart rate just synced with yours. I looked at the monitor. Micah's heart had climbed to match my own. 104, now 108, in exact lockstep. An impossible phenomenon. A sleeping child's sinoatrial node should not mirror another person's. "Artifact," I said again. But the word was thin. I tapped my own pulse against the drape. 1, 2, and the green line on the screen jumped to match, half a second delayed. Naomi made a soft sound somewhere between wonder and panic. "He's entrained to you." I forced myself to explain because explanation is how I fight panic. Mirror neurons, cells that fire when we observe motion, exist in the brain. They help us learn. But they don't control hearts. They can't. I let that hang. This isn't possible. We continued because surgery is momentum. I slipped a DeBakey under one delicate rib to apply a clamp. The moment the instrument touched bone, something like a shock traveled up my arm. Not pain, more a jolt of ownership, as if another set of muscles fired inside mine. My wrist twitched involuntarily. The clamp clattered against a retractor. For an instant, my fingers no longer felt like entirely mine. I froze, chest tight. In all my years, I have never doubted the reliability of my hands. They are the final instruments. To feel them betray me, even for half a second, was a small private terror I didn't know I could feel. Naomi saw it. "You felt that," she said quietly. "Stay in protocol," I whispered. I needed the phrase more than she did. The lights over the table flickered. A simple voltage dip, perhaps. But in that second, every shadow seemed to lean in. The monitors chirped, and then did something that stole the air from the room. A second pulse waveform appeared. 2 separate beats, perfectly superimposed, one labelled as Micah's, the other inexplicably labelled EXT, external, though no external lead had been attached, and the external rhythm matched mine. My gloved hand hovered above the tiny bones. It was not superstition, but raw data. My heart was on his screen. Naomi's voice broke. "It's conscious, Elise. It's using you." I wanted to tell her no, to tell her there is always an explanation, but somewhere deep, the part of me that dissects and catalogues had already noted the truth. The entity wasn't merely responding. It was learning. Each time I touched it, it reached back. I swallowed hard and forced procedure into the air. We finished mobilization. No sudden moves. Pride and fear are often siblings. Mine spoke together now. 16 years of never retreating from the unexplained would not let me stop. We dissected further. Every filament I tried to divide, It shifted first. Each time I anticipated, it anticipated more quickly. A dance I hadn't agreed to but could not step out of. I felt sweat slide under my gown despite the chill. My internal monologue, usually a quiet current of calculations, was now loud with doubt. If it can mirror my touch, can it mirror my skill? If it learns my patterns, what else can it claim? Naomi's hands began to shake. "We should stop," she whispered. "Call for backup, close anything." "We're here now," I said. The words surprised me with their edge, but there was more beneath. Obligation, ego, terror of leaving something unexplained inside a child. If we leave it, we may never control it again. The anesthesiologist cleared his throat. "Vitals are stable, but, Dr. Gardner, your own heart rate is feeding into the system somehow." "I've never seen its interference," I lied. My own voice sounded foreign. For a moment, silence pressed down, save for the hiss of ventilator and my own uneven breath. The tiny skeleton lay still, yet not still. Its orientation had changed minutely while we'd spoken. Its skull angled toward my hands, its small humeral heads rotated forward like outstretched shoulders. Waiting. I tested my control, flexed my index finger. A second later, the doll's index finger curled. Naomi inhaled sharply, a sound almost childlike in its disbelief. "Elise, it's enough," I said, louder than I meant. The room jumped at the sound. I softened my tone, but not my resolve. "We continue." Because stopping now meant admitting that I, the surgeon who believed knowledge tames fear, was afraid. And worse, that I had found something immune to knowledge. I leaned in, prepared the next careful cut, but my hands no longer felt fully mine. They were instruments under observation, and something unseen was taking notes. In that sterile humming room, I felt the first true crack in the world I had built, a world where understanding always wins. And as I placed the next clamp, a thought slid cold and quiet through me. For the first time in 16 years, I may not be the one operating, and still, despite every warning in my nerves, I pressed on. The room felt narrower as we advanced, as if the walls of Theatre 3 had drawn closer without making a sound. My gloved hands hovered over the tiny ribcage. Each movement now carried a weight I had never felt. Not the weight of tissue resistance, but of being observed. Every deliberate gesture seemed to write itself into some invisible ledger. I worked slowly, freeing the last fibrous threads. Each time I anticipated a path, the lattice inside mica anticipated too. A shoulder turning just before my scissors reached, a rib canting away before my clamp closed. Naomi had stopped trying to rationalize. She stood taut, retractor in one hand, her other hovering as if ready to pull me back. "Almost mobilized," I said aloud, but my voice had gone low and uncertain. Speaking the map no longer kept fear away. It felt as though the map was being copied and improved. I slid my fingers under the structure's spine to lift it free. The filaments parted slickly like wet silk, and then, in one motion too swift for the eye to track, the thing unfolded. It rose from Micah's abdomen like something remembering how to stand. Vertebrae stacked, ribs expanding. Scapulae flared as if stretching after long sleep. It was doll-sized, no longer coiled but upright on the sterile field. The ivory skull tilted until its eyeless sockets met my gaze. Every monitor flatlined for a half second, then screamed. The anesthesiologist swore under his breath, fighting to stabilize Micah. The scrub nurse gasped and stepped back hard enough to hit the stainless table. The creature's tiny hands opened. No muscle, no tendons, yet each phalanx moved with obscene grace. One hand reached toward the instrument tray and wrapped perfect bony fingers around a scalpel. The sound of steel on steel, that whispering scrape, cut through the alarms. I froze, mid-breath. Naomi whispered, "Elise, it's holding." Before she could finish, my own right hand twitched. The exact movement it made when I first learned to hold a scalpel. I hadn't willed it. The sensation was eerie and intimate, as if my tendons had been gently commandeered. My wrist rose a fraction, mirroring the doll's. Then came a sound that wasn't a sound, a static hum thick enough to feel in the sinuses. The overhead lights dimmed, leaving only the surgical lamps, bright islands of white on an ocean of dark. In that pale glow, the thing turned the scalpel the way I do, index extended for precision. My arm obeyed an echo of that turn without permission. I tried to drop the instrument, but my fingers locked. The thing stepped closer, its joints clicking faintly, and raised its scalpel as I raised mine, synchronized, but leading. I realized, with a cold clarity deeper than fear, it was no longer copying, it was teaching me. Naomi lunged forward, trying to break the loop, but the lights flickered and died to a single surgical spotlight. She stopped short, hands lifted as if entering an operating field that no longer belonged to her. "Dr. Gardner, put it down!" I couldn't. My voice cracked in a way I've never heard from myself. "I can't move." It was then I saw details that shattered any illusion of random imitation. Etched across its sternum were tiny silver lines, the shape of my operative sketches. Along one rib hung a speck of metal the size of a bead. The likeness of my fountain pen, recreated in bone, and running up its left arm were faint ridges, a pattern identical to the scars on my own forearm from a childhood injury. It had not only learned my movements, it had been cataloguing me. 16 years of operations, each clamp, each cut, lived inside this thing. Naomi's face went pale. "Elise, it's you." The static hum deepened. My pulse hammered and, on the monitor, Micah's heart and mine beat in perfect unison. The doll's empty skull tilted, and my own head tilted to match without conscious thought. My body was being puppeted by the sum of my expertise. I tried to speak, to warn them, but the words died as my arms moved. The creature guided my hand down toward my own exposed forearm just above the glove cuff. I felt the scalpel's cold kiss and knew, with surgical clarity, exactly how deep it intended to cut, precise enough to avoid major vessels, perfect to mirror the incision I'd just made in the child. Some distant, rational part of me catalogued why this was impossible. Bones cannot generate force, nerve conduction cannot jump from patient to surgeon. No tissue transmits motor control across open air. But impossibility was academic as the blade drew a red thin line across my skin. Perfectly midline, perfectly deliberate. Pain flared sharp and electric. I fought to pull back, but my hand followed the doll's as if under invisible strings. Naomi lunged and grabbed my elbow, shouting, "Stop! Elise, fight it!" Her touch broke something, a jolt like static discharge. My hand jerked free, just enough to sever the final filament tethering the creature to Micah. I felt the give of tissue, the familiar soft pop when a spinal link is cut. The thing staggered, a marionette whose strings had snapped, and collapsed onto the drape with a sound like dry twigs. Its skull turned as it fell, and impossibly, its jaw shifted upward in what could only be described as a smile, though there were no muscles to move it. Monitors shrieked and then normalized. Micah's heartbeat separated from mine, falling back to a sleepy 88. My own pulse thrashed wild and separate. Lights surged back to full power with an audible click. The OR felt suddenly huge again, but airless like after a storm. Naomi was shaking as she helped me steady the instruments. You're bleeding." "Pressure," I said hoarsely, pressing gauze to the self-inflicted cut. It was precise, clean, surgical. Of course it was. The anesthesiologist was wide-eyed but functional, pushing fluids, stabilizing the child. "Vitals holding. He's okay." I looked at the small, collapsed skeleton on the drape. Without its strange animation, it seemed inert, just ivory and filaments. But the scalpel still lay in its tiny hand, fingers curled perfectly as mine had been. I forced clinical language back into my mouth, desperate to reassert control. "Specimen removed intact, appears teratomatous with anomalous articulation." The words tasted false but gave me air to breathe. Naomi didn't move. Her gaze was locked on the doll. "It smiled," she whispered. "We will finish," I said, though my throat was dry. "Close the child, check for bleeding. Work, procedure, was the only way forward. But as I tied the first suture, My hands felt foreign, as though a new memory had been stitched into them. Every motion replayed the creature's perfect mimicry. Each knot felt observed even in its absence. I dared one last glance toward the inert body. Its head rested sideways, hollow sockets fixed on me. Even collapsed, it seemed to know something I did not. Somewhere deep inside, the foundation of my life, that understanding tames fear, shifted. Because tonight I had understood nothing, and something I could not explain had borrowed my hands as easily as a teacher borrows a student's pen. We finished the closure in silence, except for the soft sound of sutures sliding through skin. The OR clock ticked toward morning. The hum of HVAC returned like a heartbeat I was no longer sure was mine. As we dressed the wound and prepared Micah for recovery, I could not stop staring at the tiny figure on the tray. So still now, yet full of everything it had taken from me, and I knew, with a certainty colder than any chill in that room, that this was not over. The OR was scrubbed clean by the time dawn reached the hospital's brick facade. The nurses had wheeled Micah to recovery. He slept, vitals steady, a child who would awaken with nothing but a neat midline scar. The specimen, sealed in a stainless tray, had already been sent to pathology for gross examination. On paper, the night would read as uneventful. I sat alone in the surgeon's lounge with a cup of coffee that had long since gone cold. My right forearm, now dressed in a sterile strip of gauze, throbbed in a slow, stubborn rhythm. Not pain, but reminder. The cut was perfect. Midline, layered just deep enough to require closure, but avoiding every major vessel. I hadn't wanted to make it. My hand had done it anyway. Protocol demanded an operative note. I opened the electronic record and began typing in the same crisp tone I've used for 16 years. Exploratory laparotomy for undifferentiated abdominal mass. Findings: teratomatous structure with anomalous osteoid articulation. Removed intact. No major vascular involvement. Minimal blood loss. Patient tolerated procedure well. I stared at the word teratomatous until it blurred. It was a lie, of course, but the only lie the system could accept. There is no billing code for sentient, fully articulated skeletal mimicry with parasitic motor learning. Hospitals survive on language that fits into drop-down boxes. By mid-morning, the department chair called me to review the case. He skimmed my note and nodded. Strange teratoma. We'll call it a rare osteoid variant. Parents don't need details beyond benign pathology. I wanted to say, it held a scalpel, it cut me open, it smiled. Instead I said, yes, rare. Because I could see the machinery behind his eyes. Litigation risk, academic embarrassment, the instinct to bury the inexplicable before it infects reputation. Pathology's preliminary report arrived hours later. Complex osteoid structure with anomalous joint formation. No viable marrow. No evidence of malignancy. Developmental anomaly. Clean. Unquestionable. Wrong. Naomi lasted 2 more days. She found me in the locker room on the morning after pathology signed off. She looked hollowed out. Hair pulled back in a careless knot. Eyes rimmed red from lack of sleep. I'm resigning from surgery, she said without preamble. Her voice was flat, deliberate. I can't trust my hands anymore. Every time I hold a scalpel, I feel it waiting. I told her to rest, to give it time, to remember that trauma reshapes perception. I spoke like a mentor, but my own hands trembled when I tied my mask later. I could not promise her she was wrong. Weeks passed. I returned to work, at least outwardly. Cases came and went. Hernia repairs, appendectomies, resections. I forced normalcy, but something fundamental had shifted. My right hand developed a twitch, a subtle, almost invisible jerk at the edge of certain motions. At night, I sometimes woke to find my fingers moving in small, deliberate arcs across the sheets, as if rehearsing sutures in the dark. One morning, I discovered a new thin scar along my forearm parallel to the first, faint and perfectly placed, with no memory of having made it. I am a surgeon. I know exactly how a wound heals when it was closed well. Someone, or something, had closed this. Fear, once ignorance of cause, had become knowledge without control. I understood what had happened. The thing had learned me. It had touched my motor memory, carved its language into my muscles. Knowing that did not help. Administration closed Micah's file as resolved. The child recovered quickly and went home. His parents sent a thank you card with a whale sticker on the envelope. I could not bring myself to open it. I tried to reclaim routine, sharpened my fountain pen, drew diagrams for new residents, lectured on embryology, but drawing felt different now, as though another invisible hand sketched with me. Once, late at night, I glanced at the OR gallery glass, the panel that lets observers watch without contaminating the room, and in its faint reflection saw two hands moving in perfect unison. One mine, one smaller, pale as bone. When I turned fully, there was nothing, only the hum of HVAC and the silent cartoon murals. My resignation letter remains unwritten but half-formed. I still operate because habit is powerful and patients need care. But each incision now feels like an invitation. A door I open knowing something may be on the other side. Watching, ready to learn. I used to believe that mastery kept chaos at bay. That fear dies when cause is found. But mastery can be stolen, cause can stare back, and fear can learn. Tonight, before I leave, I open my operative log. I draw the thing again from memory. The perfect ribs, the small skull, the way it stood. My pen moves with unnatural fluidity. Halfway through, I realize the tip is tracing a line before I decide to. The diagram finishes itself. Behind the glass of the darkened theatre, something moves in perfect sync. I don't look up. I already know it's there.